Yeah, please. He will be presenting on the chronic dacryocystitis in cystic fibrosis, a novel ocular manifestation.
Good morning, everyone. So this is a case report of chronic dacryocystitis in cystic fibrosis case. Brief introduction. Cystic fibrosis is an autosomal recessive disease caused by the mutation of CFTR gene on chromosome 7, mainly affecting lungs, pancreas, liver, sweat gland, and vas deferens. Ocular manifestations are uncommon, and chronic dacryocystitis has not been previously documented in any population. I here present the first case, emphasizing the need of heightened awareness among clinicians. So a 28-year-old female with a confirmed diagnosis of cystic fibrosis who had undergone right lung lobectomy due to pulmonary complications of cystic fibrosis at the age of 22 years. Her chief complaint was persistent watering and swelling and redness over the medial canthus of the right eye for the past 7 days. So there was recurrent tearing and occasional discharge over the past 6 months. Other history, significant history involved systemic history. The patient had undergone right lung lobectomy and had no other systemic involvement at the time of presentation. Drug history involved, the patient had taken a combination drug of lumacaftor and ivacaftor along with bronchodilators and inhalational steroids. Oral and intravenous antibiotics were only administered in cases of exacerbations. Patient belonged to lower middle class background. Pallar icterus cyanosis were absent. Lymph nodes were non-palpable. Clubbing was present. Systemic examinations include coughing, nasal congestion, and because of repeated episodes of pneumonia, the patients had symptoms like fever, coughing, shortness of breath, loss of appetite. The other systems, which included GI, nervous, and cardiovascular systems, were normal. Among the ocular examination, the vision, pupil, the conjunctiva and sclera, cornea, and the posterior segments were normal. The positive findings included the lid adnexia, which presented with tenderness, erythema, with sinus tract over the right medial canthus, and syringing gave us a regurgitation from the upper puncta. So for the management, we started with topical antibiotics. We started with moxifloxacin QID. Systemic antibiotics, comoxiclav was given twice daily. And then for the surgical management, we started with external DCR with sinusectomy of the right side. So this was the postoperative day 1 image, and this was the 3-month postoperative image of the patient. So to the best of our knowledge, this is the first reported case of dacryocystitis in cystic fibrosis. Although cystic fibrosis primarily affects the exocrine gland, including those in the respiratory and digestive tract, the involvement of the lacrimal system has not been well documented. Possible mechanisms may include altered mucin composition affecting tear duct function or increased susceptibility to bacterial colonizations due to impaired mucociliary clearance. So we conclude this case by stating that this was a rare occurrence of chronic dacryocystitis in cystic fibrosis case, challenging the conventional understanding of cystic fibrosis related manifestations, especially ocular manifestation. Further research is essential to delineate the pathophysiological links between cystic fibrosis and lacrimal system involvement. Thank you.